Tonight, Spain has reported what's believed to be Europe's first death related to monkeypox, and it follows one reported in Brazil as well, 5 others across Africa. Now, there have not been any reported deaths here in the U.S. so far. Authorities, though, say the rising number of cases is concerning, especially since the vaccine is in such short supply right now. And while federal officials have yet to issue a national public health emergency, New York and San Francisco have somewhat taken matters into their own hands. San Francisco becoming the first major city to declare a local health emergency. And Dr. Peter Chin-Hond is a professor at UCSF specializing in infectious disease. It's good to see you. Thank you for your time tonight.
Thanks for having me on, Natasha.
Thank you. You know, we know that your city has declared a public health emergency. San Francisco confirming 261 cases out of the almost 800 in California. What are you seeing in San Francisco right now?
Well, we're seeing a big diversity of cases. They're not all mild and self-limited. They're very painful and cause a lot of suffering. We've admitted about, maybe a few patients already in the hospital. They usually come in with intractable pain, problems going to the bathroom, and secondary infections. So I think that secondary infection of bacteria on the skin that can get into the lesions from monkeypox is what can cause death. So I think with these cases around the world now of people dying, which are not the majority, but it's still concerning for the fact that it's not necessarily a benign disease. We've seen cases double in the last week in San Francisco, and we needed to do something.
Yeah, and we are hearing that the SF Health Department has requested 35,000 doses of vaccine. It's only received 12,000 doses, though, as of yesterday. And the federal government as well has not declared an emergency. Why not? Are they dragging their feet? And do you feel the public health response has been adequate so far?
The public health response has not been adequate. The public health departments are working on a shoestring budget. We can't take money or poach money from COVID emergency funds. So they're going on their regular budget, which is wholly inadequate, particularly in places where there are big epicenters of disease. I think in terms of the country, we're limited by diagnostics, not for supply, but for people actually doing the testing. So if you can't see what's going on, you think that nothing is happening.
Absolutely. And you are an infectious disease expert. We want to benefit from your understanding of this. How is this outbreak looking at this point? Is it too late to get out in front of it? And do you expect to see cases just continue to rise exponentially?
Well, the answer is we will definitely 100% see cases continue to rise exponentially, but it's not too late. We actually have the tools. We have a PCR test. We have a vaccine. We have drugs to treat the most severe cases, but there are problems with each of these buckets. And by having a public health emergency declared nationally, we can mobilize resources to really nip this in the bud because time is of the essence. We don't want this to spill over into general population. We don't want this to become endemic. And again, we need people to report illness nationally and systematically so we can know what we're going on. Right now, we're basing it on wastewater, really, because that's the only unbiased estimate that we're seeing. Again, because enough people aren't doing the testing.
I mean, do you think stigma may be a part of that? The messaging from the CDC so far has been so clear, for lack of a better word, that this is mostly affecting the MSM community. We know the CDC director came out, perhaps it was exactly a week ago, saying that the 2 first cases in children that we saw were because of the, they received that diagnosis after contact with gay men. And there was a tidal wave of hatred towards the LGBTQ community, and the hashtag groomers was trending the next day. Is stigma an issue here, and does that make it even more difficult to track cases accurately?
Yes, stigma is very insidious and also very obvious. It's obvious when somebody gets attacked or gets a lot of emotional abuse because those scars don't go away. But it's also insidious because people who don't think of themselves as part of that group don't think of themselves as being risk for infection. So that can delay control of the outbreak. For example, if men who have sex with both men and women don't think of themselves as part of the community, they may unwittingly spread it to other members of the community and not get diagnostics, not get vaccines, because if you're lining up in a line for monkeypox vaccine, essentially coming out to the world.
And so can you just bottom line this for us in the 30 seconds we have left? Who should be concerned about this? Can anybody get it? Who should be getting the vaccine? And what treatment is available at this time?
So right now we should be laser focused on gay and bisexual men. That's where the bulk of disease is. But we should have different messaging to the general population, which is not to panic. We have all of these tools available. I think in terms of therapeutics, we're there's a lot of inequities right now. It's concentrated in academic centers that have the infrastructure and the funding to fill out all the paperwork that the CDC needs. So a lot of stuff needs to be well-oiled, and we're not even close to it right now.
Yeah, Dr. Peter Chin-Hong, we certainly appreciate your time. We appreciate your perspective. Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.